What are the top 3 shoulder injuries I see as a non-surgical orthopedic doc? I'm Dr. John Tait. I'm a non-surgical orthopedic doc, and I do regenerative medicine in my practice. And I'm going to just walk you through what I see week in, week out, month in, month out in my practice when it comes to shoulders. I've detailed some other videos on knee issues, meniscus, and some other things. Today we're going to tackle shoulder, and this is a shoulder. So, if we look at the anatomy of the shoulder, the one big distinction when we look at a shoulder compared to a hip is just we have a massive range of motion in the shoulder. We think about where the shoulder can go or our arm can go in relation to the body compared to most people's hip joint. Unless you're an Olympic gymnast, you don't have the mobility you have in a shoulder in your hip joint. And part of that's because of the socket depth. So it's a much deeper socket in the hip. It's a much more stable joint because of that. In the shoulder, it's not. It's a shallower. If we flip this on its side and we can remove the muscles, the ball of the humerus here sitting on that shoulder blade, what we call the glenoid socket, it's kind of like a golf ball on top of a golf tee. So really shallow socket. And it has an extension of that socket called a labrum, which is a flexible piece of cartilage. Okay? And then we have all these muscles around it. So when you hear somebody talk about a rotator cuff, well, what the heck is a rotator cuff? If we look at the back of the shoulder, we can see this muscle running across the top half of the shoulder blade, and then underneath that spine of the bone, this muscle. So we have the supraspinatus and we have the infraspinatus running across here. Okay, and below that we have a muscle called teres minor. And on the front of the shoulder, a muscle called subscapularis. Those 4 muscles comprise the rotator cuff. So what does it do? Well, it grabs this ball, okay, it cuffs that ball, and it rotates it. So depending on what muscle fires, that lever is going to pull and rotate the shoulder in a certain direction. So the subscap on the front of the shoulder is going to rotate the shoulder in. Supraspinatus, if you put your thumb down, take your shoulder up, that's going to be the elevator for the arm there. And the infraspinatus is the primary external rotator. So if your elbow is on your side and you're rotating out, that muscle is kicking in, so is that teres minor to some degree. So on the top of the shoulder, if we look at the bony anatomy, we see the collarbone running across, meeting the shoulder blade, and there's a small joint here. So there's actually 2 joints in the shoulder. A lot of people I see don't know that. They think about that ball and socket joint. There's another joint here that sits between your collarbone and the shoulder blade called the acromioclavicular joint. So AC joint is what that's abbreviated by. So we can see arthritis develop in that small joint. We can see arthritis develop in the ball and socket joint in older patients or people that have had a lot of injuries earlier in life and aren't old, but maybe they're middle age, and now they're having some issues with that joint. So if we take them in order of what I see in my practice, the most common thing that walks into my office is some type of rotator cuff injury when it involves the shoulder. So that involves some degree of strain on this tissue, really at the attachment point. So a muscle becomes a tendon and attaches to the bone here, and we can tear away fibers of that muscle tendon. And that is what a rotator cuff tear is. And then we have to understand, well, what muscle's involved? Because again, as we look at this structure front to back, it's pretty continuous structure all the way around this ball. So when you read an MRI report, it will talk about these individual muscles. It will talk about if they're torn. It will talk about if there's tendinosis, like a fraying in that. But we need to understand what is actually injured there and the extent of which it's injured. So number one thing I see in my practice is rotator cuff. When it comes to shoulder, rotator cuff injuries, number 1. Number 2, underneath that, I detailed another video recently about labral injuries. Again, that flexible cartilage that deepens the socket inside the shoulder here. So labral injuries are number 2. When I have younger athletes, particularly people that are pressing a lot of weight overhead, heavy bench press, good mechanism to shove that arm back into the socket and potentially tear the labrum. And the third thing that I see is some version of aggravation of arthritis, whether it's in this AC joint or whether it's in the bigger glenohumeral joint here of the shoulder. Those are the things that, when people transition through middle age and maybe they've had some injuries earlier in a younger age, then they could start to be developing some version of arthritis and some grade of arthritis, either in the AC joint or the big joint. And again, oftentimes it's not that clean, meaning people will come in with some version of all of those combined together. So they could have a rotator cuff injury, they could have something going on with the AC joint, and they could have something going on with the labrum or the ball and socket joint with some measure of arthritis there. So, when we look at this, I want to just do a little 101 anatomy today, because a lot of people, when they're given a diagnosis, they say, hey, you got a rotator cuff injury. It's not really explained thoroughly, and we need to understand really clearly what tissue is injured so that then we can map out what type of treatment follows that. And the last thing I'm going to say about this is there's a mechanism by which we can strain the ligaments around that AC joint. And I just want to touch on that for a minute. So people commonly use dislocation incorrectly or separations, they don't know what it means. So let's just kind of get that out in the open today. When somebody dislocates their shoulder, which is a massive injury to the shoulder, the ball actually dislocates out of the socket. So it pops out of that shallow socket, and sometimes it can hop back in, and sometimes people got to go all, Mel Gibson, Lethal Weapon, like pounding their shoulder into the wall to try to relocate it, which I don't recommend you do. I recommend you have a professional relocate your shoulder if you ever land yourself in that predicament. But some people are hypermobile, and what that means is, if you look at average, and I would say I have average mobility, if you put your hand out and you push your finger back and you see just the extent of how far you can bend your finger up, some people can bend their finger up to 90 degrees and beyond. So that's what we call hypermobile. It means that tissue can stretch. It's a little bit more elastic than the average person, which makes them more susceptible to these kind of dislocation injuries. If they really crank the arm up into extreme kind of vulnerable range of motion and they get hit, so this is like somebody going up, say in basketball, a couple people fighting for the ball, you get your arm taken backwards, you can dislocate the shoulder that way. Or if you fall on an arm outstretched like that, you can dislocate a shoulder that way. The separation injury comes here. So this is where athletes are, taking their shoulder and they're running into people. So this would be football players, hockey players, things like that. Or they hit the ground and land on the tip of their shoulder is a good mechanism to cause a separation between these two bones. So again, if we take the collarbone over here, we take the shoulder blade coming around to meet that joint in the middle, separation means we've stretched these ligaments through different grades, 1 through 4, depending on the severity and what ligaments around the shoulder here are torn, and that separates that shoulder joint. And again, depending on the grades, different treatments follow. So that's the basic kind of 101 level on a shoulder. What is the anatomy? What are the common injuries? I'm going to jump into another video, kind of dig deeper in each one of these and really detail the different types, what I do as a non-surgical orthopedic doc, particularly when it comes to rotator cuff injuries. It's a very, very common thing that comes into my practice. But I just wanted to lay some groundwork in this video today, talking about some basic anatomy of the shoulder. So if you like that and you want to see more quick down and dirty anatomy videos like this, click the like button or subscribe to the channel so you know when we do updates like this with new content. If there's comments about that anatomy, throw it in the comments below. And if I can help you in any way, if you're dealing with a shoulder injury, look at the notes in the video. There's a link that will take you over to my practice. And if you're looking for a non-surgical opinion on your shoulder, because that's what I do don't do surgery, do all the non-surgical things, fill out that form and a happy, smiling team member of mine will get on the phone with you and dig through your case a little bit and see if there's a right match for the things we do for the problem that's holding you back, keeping you out of things that you love doing.